Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are here sharing their insights and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions. We help businesses scale revenue through outside-the-box visibility strategies. If you're new to the podcast, welcome. You joined on an amazing day, and I'm excited to have you here. But without further ado, I want to introduce my guest today, Clayton Swalstad with Integrated Psych Solutions. So welcome, Clayton, to the podcast.
Hi, Heidi. I'm glad to be here and have an opportunity to talk about our story. It's been quite a journey.
And I can't wait for you to share it. We've been chatting a little bit about this behind the scenes, and you're now in South Carolina, but you're a fellow Floridian. You've lived here for a number of years, so it's exciting to talk to somebody that's lived in Florida. I don't meet a lot of people from Florida lately, but it's exciting when I do. So, Clayton, can you kick us off and share with us about your journey, about who you are? Also about Integrated Psych Solutions and your role within the company.
Absolutely. As far as Integrated Psych Solutions, the company itself started a little more than 5 years ago with a couple of physicians in Augusta, Georgia. And they were doing psychology, mental health services to people in the burn and trauma unit at Doctors Hospital of Augusta, which is the largest burn center in the country, second largest in the world. And they realized that these patients suffering burns and significant trauma needed more than medicine. They needed a mental health crutch to help them navigate god-awful injuries and their family members. So one of the physicians that started that was a friend of mine I had actually hired in a previous life as a medical director. And he called me. I was working up in Fort Wayne, Indiana at the time with Parkview Health Systems, and wanted to know if I'd be interested in coming back and take this two-person operation and make it a company, and which is my background. So I returned to South Carolina, where we always had a family farm, and Augusta's right down the road from us. So I became the CEO. I rebranded the company. It was at the time called Inpatient Psych Solutions, which fit the name inpatient. But when we encountered these people on the inpatient side, we quickly realized once they're discharged, then what? Mm-hmm. So I built an outpatient model to where they could continue services through our therapists, social workers, professional counselors, psychologists, neuropsychologists, to help them navigate the new adjustment in their life now that they're out of the hospital. And it's taken its time and morphed over the few years, but we have 3 hospital contracts now in Augusta, for example. We have a large outpatient presence. We've partnered with their federally qualified healthcare centers, FQHCs, who have a lot of Medicaid population, and very difficult to provide benefits for those folks because Medicaid really doesn't cover behavioral health. So we've worked with them to navigate through insurance companies to get a little better rate to provide that critical needed care. So that was where we started and where we are. How I got here outside of that trip to Fort Wayne, Indiana is a whole nother who built the CEO, Clayton Swalstad, which I am the CEO and actually recently transitioned to president of the company because I relinquished more of the day-to-day operations to folks that are more focused on it. And I work on the growth relationships, C-suites with hospitals. I work with our lobbyists out of Atlanta, Georgia, to make sure we're involved in legislative activities to continue to grow the mental health benefit for people in the state of Georgia and in Florida, for example. So my career started as a high school dropout back in 73. I guess I'm gauging myself a little bit. And I dropped out of high school, fortunate enough to get in the Air Force. I had a high school counselor that saw more in me than I did. I was just an angry kid. And he got the Air Force to test me. I scored super well on what they call the ASVAB for mechanical and administrative. So I got a contract to go in the Air Force as long as I got my high school diploma or GED within a year, which I did. I was no dummy. I was just angry. And I somehow came out of the Air Force 20 years later with a master's degree, a bachelor's from SIU Carbondale in industrial technology, a master's in management from Troy State at the time, Troy, Alabama. whole opportunity, a young guy for a new career, and I went into healthcare coming out of the military. My background in the military was transportation and logistics, airlift, airfield operations, that kind of thing. And I didn't want to do that when I retired, so I partnered with a gentleman when we joined the same church together in Satellite Beach, Florida, and coincidentally, he was a healthcare administrator for a large group and talked to me about doing some work and contracts with him, which I had experience in. From that point on, I grew my own company and then had multiple positions as a senior executive in different hospital systems, managing hospitalists, emergency departments, staffing them. And so it's been a journey, and it's been a lot of fun. So now we're growing. Our operations in Georgia are great. We actually have quite a footprint in Florida. We're covering 2 hospitals in Ocala. We have boys and girls clubs in North Florida. We have some school districts in North Florida where we do telehealth for young children in school, working with the school counselors. And we cover the 17 northern counties of Florida through that side of our business. And we cover 4 or 5 jails now, where we're trying to get ahead of recidivism or reduce that return rate, because when you're in the county jail system, you tend to be a minor offender, probably something simple. And if we can help them understand that they're accountable to it, they won't become state hosted residents or convicts, almost, if you want to change the word. Takes a long time to make a convict. We just assume they stayed a mistake for the weekend and go back home.
Yeah.
We answer, there's a hotline that rings through North Florida, the 17 counties, and it actually rings in my office in Augusta, Georgia, and we assign therapists to these people to help whatever their need is. So it's exciting work. It's a wide open work with, I don't know, there ain't enough of us.
I love that everything that you're doing, and you're doing a lot. Wow.
In between time, it's as I talked about. I also believe in personal return. God's given me some talents and opportunities, and so I do Kairos Prison Ministries at a level 4 system correctional institute in South Carolina, and that's Kairos International. We have a chapel corporation that I'm the chairman of, that we joint ventured with South Carolina and built a chapel inside the penitentiary. For these people, regardless of their religion, faith, as long as it's a recognized religion, can have a place to go and find that bit of solace. When you're in prison, you're there for reasons. Right. But that doesn't mean you shouldn't have an opportunity to have some dignity and some time to share whatever your religion is. It doesn't have to be Christian. It could be Muslim. It could be Rastafarian. Our goal was to build a place where they could do this and have a better educational opportunity also. Yeah. And then I'm a guardian ad litem, for social, assigned to kids in court, which is a relatively new venture for me. So there is time I sleep, and I like to fish every once in a while. So.
Well, I'm glad you have some time to do the things that you like to do, and you're getting some rest in between all of these other things, because that's pretty amazing. Like, whatever vitamin you're taking, please let us know, because I want to take it. I need some of that. But Clayton, on a serious note, I think it's fantastic what you're doing. And you had made a comment at the beginning of your story and your journey that somebody believed in you more than you believed in yourself. And that was really what flipped the script for you and changed things and opened up a new pathway for you. And you took advantage of it. You didn't take it for granted. You had these stipulations. I will use that for a lack of a better word. Stipulations that things that you need, goals you needed to meet in order to stay there. And you met them. So you really took advantage of the opportunity, that's on you, right? That was that you, yes, you might have been angry, like you shared, but somebody opened the door and you stepped in and you went for it. And that says a lot. And now I love that you're giving back and you're helping the youth in Florida, that, you had a bad weekend, and let's see how we can flip it. This doesn't have to be your story forever, right? This gets to be one page in your entire book that is going to be written for you, and you get to write what's coming up next. This doesn't have to be the full story. And same thing with your ministry and your work inside of the jail system. So thank you for all you're doing there. I love that you're giving back, and we definitely want to share in this how people can learn more about all of that, which we'll get to at the end. So you mentioned that your practice, your company emphasizes personalized and flexible mental health services. So what key elements differentiate your model from traditional settings?
Absolutely. Good question. The thing that really brought our company out of the ground was our psychologists and neuropsychologists working in the acute setting. That was very unusual. We actually had to work with medical staff to get privileges and credentials for them because MDs and DOs, medical doctors and doctors of osteopathy, were the medical staff. We had to change medical staff bylaws. That's what made us unique to start with. And we had to get special credentials for our therapists to provide this care in the hospital. And I think that's what made us unique. There's companies that do psychiatry. They have psychiatrists in the hospital, but that's not the same as a therapist sitting day to day with these patients when they're in that acute setting in the emergency department because of suicidal ideations or something like that, where our therapists, master's level therapists, can start working with those people right away. They may need placement, but that also they need therapy. They need someone to talk to during that phase. And that's what made us unique. And now we've added psychiatry. We have the psychology, neuropsychology for cognitive testing. We cover a couple of inpatient rehab units. Those folks have had devastating strokes primarily and other TBIs, traumatic brain injuries, things like that. And we have to determine their cognitive abilities. So our team goes and works on that. And then we start working with therapies, not only for the patient, but we also will educate staff on there may be some triggers if they have bad behavior. What is that? What can we do to train everybody to try to prevent that? When they come into our outpatient setting now, we can support them. And our outpatient setting is more common to the marketplace. That's where we have a psychiatrist doing appropriate psychotropics or medicine management. But we also back that up with therapy because we can give them pills all day long, but if we don't help them walk through that process and to kind of come out the other side, they're going to be just on psychotropics the rest of their life. Hopefully we can adjust that. We also work aggressively with pediatric or younger children, adolescents, to really rule out the ADHD. And that's a very common diagnosis, but not necessarily appropriate. If we can look at what the underlying issues are, we might be able to treat a symptom or two and take these kids off a lot of those medications. It's a tough job, but if we save one, we saved a lot from being on those meds for the rest of their life or through their school year when it was really dealing with triggering the anger. Helping them understand home environment, things like that. So is the model unique? I don't know. I think in the acute setting it is. In the outpatient world, we partner very closely and have created a very good tele-mental health counseling arm through the schools. Part of our model, some of the kids in Florida schools, not all, but some of them get a little iPad that's basically hot wired to us. They can't use Pac-Man on it or whatever the kids do these days. It's got an icon that they can tap at the appropriate time. And my therapist, one of our therapists, will be on the other end to help them, him or her, talk about what's going on today. We make sure that they have a project list. It's kind of like homework. When our therapists talk to them, we may send out a book to them, that a daily journal that they want to track. And especially with the bullying and things we see in schools today, I think it's very important because kids start to write that down and they're starting to recognize it's not okay. Right. And it's not me. It's the bully. And I think that's made an influence or a change in their I guess just their ability to navigate school, navigate their relationships. And we really do the same principle with the jails. We give them daily journals. And they're kind of sequestered, so they have time to do it. There's not a lot of alternatives,
right? No excuses.
No excuses. Get this done. But it's been very effective. And their spouses can actually call our 800 number, and we can counsel them separately. if they
Oh,
choose.
that's amazing.
Yeah, it's funded through the state of Florida and through block grants from the federal government. So we can reach out, and that's what that money's for. Really get to these people that truly need it.
Well, I just think it's amazing. First, I want to say I love that you referenced Pac-Man, because that was the game that I like. That was, I think, that was the first game that came out on Atari when the video gaming craze hit the market, what, in the 80s? And I was part of that. So that was like a great, I love that. That made me smile. I also liked Asteroids and Pitfall and some other ones. So yeah, there were some great games. But anyway, I digress. But I love that there's so much that you're doing, and you're with different target markets. And for a lack of a better word, I'm saying target markets, but you're not just helping one. And mental health is we need more services out there for people to support them in their mental health. So I'm really grateful that we're having this conversation today and I'm blessed. I feel really grateful and blessed that we get to be part of shining the light on the mental health crisis, especially, and I know it's grown a lot since 2020 with the pandemic. Hopefully we're starting to see a downturn of it. I don't know, because I don't know those stats, but I'm really grateful that you're doing the work you're doing with the children, with the people in jail, and with the trauma victims that have gone through the burns and things like that. And the other people that you're helping as well. So you've grown a lot, working with a lot of different types of demographics in just 5 years. So what strategies have been the most effective? What strategies have most effectively supported your growth, whether it's been your team, reaching new patients, new people, or deepening your service offerings, or all of it?
It's a piece of everything. Part of it, because of my senior experience in healthcare, I know a lot of the hospital C-suites. They were young executives when I started out in healthcare, and they've grown along with myself. And so I can reach out to those folks. Working with payer relationships, I've had a very long background in managed care contracting and building, kind of identifying the need, identifying the right staff. Just having a credential isn't a good therapist sometimes. So finding the right staff, making sure we train them and empower them to be something more. Master's level social workers rarely get an opportunity to work in a hospital like ours do. So they're really excited about the opportunity to serve. They can follow patients back in the outpatient clinic if they choose to. Some of those patients you bond with, and they can follow them in the outpatient. So I think they're modeled the way we treat our staff, quarterly get-togethers, day at the farm, whatever I can do to recognize their talent personally and their contributions personally is more valuable than paying them well, which I believe we do. Really acknowledging them and to prevent a bit of that burnout. If they're in the hospital every day and they've got nobody that tells them you're really doing a great job, I would burn out and run away. So I think we've bent that curve a little bit to our favor. I think it's critical.
Yeah.
Some of the hangups maybe starting through my multiple positions. I've been in a couple different companies, having the appropriate funding to start, because you will consume revenue. If you haven't considered it, make sure you have the opportunity for investment venture folks cautiously. If you go to them too soon, you pay too much. If you go to them too late, you may not get it. So understanding a bit of a balance there on how to manage and what your growth expectations are, and projecting funding for those growth expectations. You can't hire 2 doctors and all of a sudden realize you don't have money for their payroll type thing. So you talked earlier about companies losing or failing within that first 5-year window. Generally, it's because, one, they burned up their own resources and they weren't prepared for the financial burn, if you will, on the growth opportunity. Good. Go ahead.
So we're we're in the middle of talking about growth, which this is the reason we do this podcast. Cause like you said, you're in that sweet spot of, the reason I was telling you behind the scenes, the reason we created this podcast is because so many businesses, 90%, over 90% businesses fail within the first 5 years. You're thriving, you're growing, and it seems like at a rapid rate. Question for you at pandemic stage, because I would love to know when you all like really hit the ground running with this, or when you were brought in and then rebranded. So post pandemic, how has the company adapted, especially around, you mentioned telehealth or any hybrid approaches, and what benefits or, on the flip side, challenges have you observed?
I think that the challenges was finding staff, especially coming out of the pandemic. I came back here in mid 21 and started with them, I believe it was August of 21, retooling the company. But what I found is because of the pandemic, our psychologists, our therapists, everybody wanted to stay home in their jammies. Nobody wanted to come to work anymore.
Yeah.
So that first year was a struggle. When I looked at people's CVs or curriculum vitae or resume, what have they been doing for the last 2 years? Working from home. And they would apply for my jobs and they go, well, you mean we have to come into the office? So that was, the first year was probably the most difficult. Getting a workforce that wants to come into the office, wants to come into the hospital. So that was very unique. But I'm not sure, other than that, that's COVID created the awareness for mental health. It was no longer something you should be ashamed of. In fact, quite candidly, in many circles, it became a cocktail hour discussion with, people were talking about their therapist or their app on their phone. I'm not sure they were a viable solution. For some, they worked well, but for the true continuing mental health opportunity, that was the change. COVID impacted mental health benefit opportunity. So we could do telemedicine. We did some work, and we do some work for cancer patients down in Florida. We try to do an intake in person, but these people just got terrible news. And once they start those therapies, they can't get out of bed or they're immunocompromised. So we immediately convert them to telehealth for their convenience and their safety. And then when they transition through that cycle, if they want to continue, then we can go back to in-person therapy. So we can twist that model based on what the patient needs are. And I think it's very effective. And another point about jail, I wanted to bring this up. If we've treated these people in jail in Florida and these several different counties, once they get released from jail, they can call that 800 number and continue therapy. That's no charge to them or their spouses or their family. And very limited qualifications, otherwise, because those folks tend not to have good jobs or good insurance. So we can continue their care through that program and hopefully, again, keep them out of jail. So not sure I got through the whole question, but
no, that's fantastic. That was amazing. You're answering everything, and I appreciate how open you are and all that you're sharing, and again, all that you're doing, because my head keeps spinning with everything that you're doing. I'm like, I don't know when this gentleman speaks, when Clayton sleeps. But I would love to know, Clayton, as far as like visibility, you getting out there, I know you have partnerships. Is there any other way that your company is getting out there to be seen by the patients that you're serving, and bringing more awareness to your mission and your goals? Or is partnerships really the number one strategy that is effective for you and that works? And on the flip side, is there anything that you've tried that hasn't worked for you as far as really getting your company more on the map? Because you've grown a lot in the 5 years. So I'm wondering if there's things that have really stood out that worked for you, and maybe some things that you tried it, but you don't really go there anymore.
Right. I guess the thing that works the best for us is when we get that acute hospital opportunity. We go in, and there's a lot of patients in that hospital that are uninsured, what they call self-pay. In other words, they're uninsured, they have no insurance. We have to treat those. But when we partner with the hospital, we work with them on an opportunity where they actually subsidize us, so we can treat all of the patients all of the time. And it's, because I've got to cover staff. So that the way that model works is the need. The hospital has to do it anyway. They're required to have these types of services, so they can either do a telepsychiatry model or they can have a physical presence, which is much preferred and generally less expensive for the hospital. So when we do that, but then we also now have to transition to the outpatient, and I referred to Medicaid plans and things. COVID added benefits to mental health. Some are being taken away or reduced and limited to the population that probably needs it the most. So that's in the outpatient world. I guess I don't pursue those larger Medicaid populations, but I partner with groups like Federal Qualified Healthcare Centers that have a better reimbursement, and then I can care for those people appropriately and still thrive. Yeah, I don't make a margin on it, but I'm not losing on it, which I think is probably one of the biggest things. So I don't go after a general market outside of something like that because of the Medicaid population. And it's not their fault. They're great people. They're in an income bracket that's below standard. And we want to take care of them. So we do it through those FQHCs.
Fantastic. So what's next for you, Clayton? I don't know what could be next. You're doing so much, but what's next for you in Integrated Psych Solutions for, say, like the next 12 months? What are your big goals?
A couple of things. Actually, we're actually exploring the opportunity to maybe sell or partner on a larger scale. I think what we've got is a very good model. It comes down to, do we want to raise capital or do we want to find the right market partner, which is, I think, the optimum solution to take our talents, merge with another company that has synergy and create a super model, if you will, to take this further. We're going to continue to grow, and the primary growth is in the outpatient business, and it's much easier to staff in the hospital. And so I'm going to continue to grow that. We're continuing to grow our tele-mental health presence. We're working with Georgia's legislatures right now because Georgia, like all other states, has had some very tragic high school shootings and different things. So we're working with our partnership over there to hopefully be a big part of that solution this year.
Well, thank you for sharing. So, Clayton, how can people connect with you? If those who want to reach out to you and learn more about Integrated Psych Solutions, where can they find you?
We have our website, integratedpsych.care. And if they reach there, they can message me directly. If they want to have more of a personal, our website's designed really for a bit of informative work. I don't anticipate mental health growth coming through the website as much as I do awareness for the C-suites and folks just to find out what we are. But I'm an open book. I've actually part of my previous life, I'm actually fellowed in hospital medicine from the administrative track. So I've done a lot of mentoring for executives in the hospitals, and I'm happy to work with people, share what works, tell them what didn't go so well, and hopefully keep them from bouncing off the pavement once or twice.
Well, make sure you go connect with Clayton because he's pretty amazing. So, and you're also on LinkedIn, Clayton. So we're gonna have all of your links inside the show notes. So for those of you listening, go to integratedpsych.care. Again, we'll have the links on, and his LinkedIn also profile where you can go connect with him, send him a DM, chat with him. Super great guy. And if you're watching Clayton and I right now on YouTube, thank you. We appreciate you being here, and we would love for you to share this episode. If you know anybody that could use mental support services or learn more about Integrated Psych, the company and Clayton, then please share this. Please let more people know we can't do this alone. We need your help and your support in sharing this interview and this message and this episode out to more people that could possibly use this support. There's a subscribe button. So if you want to hit that to make sure that you're aware of more amazing guests like Clayton that are coming on and sharing what their mission is, what they're up to, the amazingness they're creating in the world like Clayton is, as well as their business, then that'll allow us to ping you to let you know that we have a new amazing guest like Clayton on the show. If you're listening to us on your favorite podcast platform like Apple, Spotify, Amazon, iHeartRadio, any of the other ones, and you can leave us a review, we would be super grateful for that, especially 5 stars. That allows the platforms to think like, hey, they have some good stuff there, and they're going to share it out with the world. And right now, today, this is really good stuff that we need more people to listen to and more people to hear. So we would love a review. We'd love 5 stars so we can share Clayton and integrated psych solutions with more people. If you're looking to grow your visibility, Clayton has shared what's working for them as far as their growth, and they've grown a lot, and they're helping a lot of people in just a short amount of time. If you're looking and you feel like you've tried different things and it's just not working, then go ahead and download our free Spotlight to Scale blueprint. You can go to spotlighttoscale.com/blueprint. Go check it out. It's yours. It's free. Let us know how it's working for you. Clayton, is there anything before I let you go and we wrap up for the day that you'd like to share that I didn't ask you or we did not touch on today?
The one piece that I didn't have to share, I could share, is I'm coincidentally, I'm also an ordained minister. So
Amazing. So
that's not what I practice doing. I don't preach on Sundays, but I am ordained.
that's amazing. See, how do you, like, I don't know when you sleep. Seriously, I don't know when you sleep. Again, whatever you're taking, share it with everybody.
There you go.
We all want that vitamin. We all want that vitamin. But no, seriously, I'm so grateful to have you on the podcast. Thank you for being a yes, just spending your time. I know you are super busy. And I know I'm taking away from fishing and all the magic that you're creating in the world. So I appreciate you spending an hour with me today. So thank you for your time.
No worries. I appreciate the opportunity. Thank you.
And thank you for listening to Clayton and I today. And we look forward to seeing you on the next episode of the Business Growth Spotlights.